My relationship with my mother is really strong. The hardest part is definitely watching her go through this. It's really painful to watch her being scared to go out. She feels like people are scared of looking at what's on her face.
This whole journey started back in 2005. My mom developed this skin cancer on her left side of her face. Unfortunately, we kept going to doctors. We went to Little Rock, Arkansas, saw a specialist there, took care of it the first time, and then 2 years later, it grew back again. As time went on, it just kept getting bigger and bigger and bigger, but we would always tell her, go back to Little Rock and get it checked out. And again, she's a very stubborn lady, doesn't really like to ask for help, and she just went on with it. She said later. And then again, we revisited the doctors probably back in 2009. We went again, same thing, it grew back, took care of it again. We were very confident that this was done. And now that it's coming back, obviously it's rare. Not a lot of doctors know about it. And I know Dr. Osborne has said that he really doesn't blame the other doctors for not knowing. They're just not well educated with this because it is very rare and it doesn't happen on a daily basis. Seeing her like this, seeing her not wanting to go out in public, not wanting to take much pictures, she's just very shy when really she's an outgoing person. So having this mass on her face, she's just not comfortable with herself anymore. Her self-esteem has gone down, and we as a family kind of see that. She shies away from pictures and everything like that. This would be like the 4th surgery overall over the skin cancer that she has on her face.
My name is Ryan Osborne. I train as a head and neck surgeon in South Central Los Angeles, managing the most complex cancer and trauma patients in the country. I've operated across the globe in first and third world countries. My experiences have taught me the value of flexible and innovative thinking, but I realized that our healthcare system doesn't always allow for that. So I started Osborne Head and Neck Institute. I made it my mission to find the best, most creative surgeons around, and I gave them the space to excel. Together, we create a new standard in medicine. These are our stories. Imelda is a woman who has had a long history of fighting a treacherous disease called dermatofibrosarcoma protuberans. I know that's a mouthful. Dermatofibrosarcoma protuberans. It's a rare type of sarcoma that affects the skin. Because it's so rare, most physicians will have little to no experience with this condition. The best chance of cure is early detection and complete surgical removal with clear margins. However, even with surgery, these sarcomas have a very high recurrence rate. When these sarcomas occur on areas of the body that are pretty easy to cover, such as your back or your arms, patients and surgeons are much more willing to accept a procedure that may have less than an ideal cosmetic appearance if that surgery has a better chance of complete disease eradication. But when these sarcomas occur on the face, there is less tolerance for aggressive surgery. Patients are not willing to accept scarring, nerve injury, or alterations in their public appearance. That mentality ultimately leads to more conservative resections and subsequently higher rates of local recurrence. Looking at Imelda's tumor and all the scar tissue she had from her prior surgeries, we realized this would be best managed in stages. Stage 1 would involve surgically inserting 2 tissue expanders. These expanders would be inflated over approximately 6 weeks' time in order to stretch the small amount of normal skin she had to help replace the skin that would need to be removed with the tumor. Tissue expanders stretch the skin slowly and consistently, much like a baby stretches the skin over the abdomen over the course of a pregnancy. We have to develop a pocket beneath the skin. Then the tissue expanders are inserted into their new home. Once inserted, they are partially inflated with saline. So surgery went great. Tissue expanders are in. We put in two, a smaller one in the temporal region and a much larger one down in the lower cervical or neck region, as we call it. We will allow those incisions to heal, and then we'll begin expansion in about 4 weeks. Imelda and her children were taught how to inject the tissue expanders so they would be able to expand them at home, while Dr. Hamilton and I supervised them remotely. The expansion process was very well tolerated and went very smoothly. During phase 2 of the treatment, we will take her back to surgery to remove the tissue expanders. Then we will continue forward and actually remove the tumor. I think she's going to do very well. Based on the way things are looking, it looks like the skin is doing well, the wound seems to be holding well, no signs of infection, and it looks like she's taking the expanders very well.
Okay.
So today's the day. This is procedure number 2. This is actually the procedure in which we're going to remove the tissue expanders and actually resect the actual tumor burden. I'm not exactly sure how things are going to go. This is unfortunately not a procedure that's in the textbooks. This is truly surgery. We'll see what the body gives us, and we'll make decisions on a minute-by-minute basis as to what the best next step is going to be.
Be around. Okay. Buenos dias. Buenos dias. Good morning.
First, we mark out the borders of the resection, then we will remove the tissue expanders. Due to the fact that Imelda has had this surgery more than once, in fact, she's had this tumor removed at least 2 times before. She has a lot of scar tissue. So we're working our way through this dense scar tissue where the nerves are engrossed between the tumor burden as well as the scar tissue, and trying to literally dig those nerves and dissect them out. Throughout the surgery, we were searching for the branches of the facial nerve in order to protect them.
This tumor is very vascular, so every maneuver we made, there was lots of bleeding. And we're worried that she would need a possible transfusion because of the amount of bleeding that happens with these types of cases. So time is not on our side, so we have to work diligently, but very methodically and carefully because there's a lot of bleeding during the case.
Once the tumor was removed, the defect was quite large. Dr. Hamilton very skillfully used the expanded skin as well as local regional flaps in order to close the defect. The surgery's over, and both myself and Dr. Hamilton are quite pleased with the results. We were able to remove all of the visible tumor.
What we're hoping for is that she'll heal with minimal to no scarring, that she'll have full functionality of her head and neck as far as moving her head from side to side in full range of motion, being able to eat and hold food in her mouth, and open and close her eye normally.
The tissue expanders worked really well because we were able to actually close everything with no skin grafts.
That's awesome.
So skin grafts don't really look that great. It looks like you had a burn or something like that. But there's no skin grafts at all. So everything was just closed using the local tissue. And that's as good as we could hope for. So at this point, once she wakes up, we're just gonna have to just kind of
see how she goes day by day, but it's over. She'll probably still have some microscopic disease there, but when you've got so much tumor burden there, that's impossible for there not to be some. However, we've got some good friends who've got some what we call adjuvant treatments, which mean other types of treatment modalities that we implement after surgery. They're going to help to kind of control this disease.
Postoperative day 1, Imelda's wounds looked intact and all the tissue looked healthy. Despite the fact that we were able to identify and save all the branches of her facial nerve, she clearly had temporary paralysis of the face. Of most concern was the weakness of her eye closure. Incomplete eye closure could cause damage to the cornea and lead to loss of vision. To prevent this, we place a temporary eyelid weight that adheres to the external surface of the eyelid to help her close and protect her eye until her facial nerve function returns.
Everything's been going great. I think the recovery itself, it's just long. It's been a tedious process, but overall, she's been recovering very well.
She smiles more. She's more comfortable talking to people. She likes to go out a lot more.
It's just changed her life. It's changed my mom's life and the way that she sees herself.
Ha cambiado mi vida porque cuando yo salía a la calle, pues me sentía incómoda, no me sentía que la gente me miraba. Yo ya no quería salir mucho, siempre me estaba cubriendo el tumor con mi pelo para que no me vieran. Entonces eso era duro para mí porque también donde yo trabajaba trabajaba con mucho personal y yo me sentía incómoda. Pero para mí ha cambiado bastante porque me siento más segura de andar en la calle, me siento más segura de estar con la gente y no me siento realmente un cambio en mí y muy feliz porque estoy así.
If I had to say anything to Dr. Hamilton and Dr. Osborne was a big thank you, because without them, I feel like we'd still be trying to look for help.
They're great doctors. I think they care a lot for their patients. They see what is the best interest in their patient, and so I think they take their time in researching and what's the best possible way to go about this surgery, especially big ones like my mom, and I know he's done other big ones too. So the fact that they both did that, and we really appreciate what they've done and the work that they've done.
Fue largo tiempo el que estuvimos buscando y el tumor era grande. Yo pensaba que ya no iba a encontrar solución, pero estuvimos buscando y encontramos por línea, encontramos a este doctor y la verdad me cambió la vida. Estoy feliz y contenta y yo nunca pensé que fuera a encontrar a alguien que me ayudara porque allá ya me habían dicho que no había opción y estoy feliz.
It's like 360, it's beautiful to see her looking happy again and being hopeful and knowing that she's just going to continue to get better and better and better. And, at this point, you just realize this is not a quick fix solution. Life isn't always that way. You have these roadblocks, you climb over them, You have to go through that sort of transition period to get to the place that you're trying to get to. And she's still on that road, but she's definitely going to get there. And we're just excited for her.
Pues yo se los agradezco mucho a ellos que me ayudaron, que son buenos doctores, son muy amables, me trataron muy bien. Y la verdad, pues estoy muy contenta con todo su grupo porque todos me trataron muy bien aquí y se los agradezco y les doy las gracias y me dio mucho gusto de conocerlos y de saber que ellos pueden cambiar la vida a muchas personas.
And that makes me feel good. She trusted us and we didn't let her down, and we're going to support her the whole way through. I don't know if she'll need another surgery, but if she does, we will definitely be there to help her.